Professor Joseph. Frank is my first name. I'm the medical director for DAM Group Health. So I think DAM Health really came about through the COVID pandemic, with us wanting to try and make sure that people in Liverpool and around the northwest, and then more laterally throughout the country, were given the opportunity to have real-time, good quality PCR testing for COVID-19, so that we could support the public health efforts to try and keep this pandemic under control. We obviously started our operations here in Liverpool, which is where we're all from, but quickly realized that there was a need for similar services across the country. We've had to expand very rapidly within town by starting off in Rodney Street and then moving into Rose Lane. So we're now operating out of different sites. And it's been really nice because we're able to give back to the local community. We're able to get more people on board. I think as of last count, we had 54 people working with DAM Health across Liverpool and Manchester now. That's people that we directly work with, and then we've had a affiliate program to try and bring other people with similar facilities that we could support across different cities. So Birmingham, Coventry, Leeds, Bradford, London, where we've had affiliate partners who have been able to provide jobs locally for their own kind of staff and people around the local area. I think that the project, the work has just grown exponentially, and demand has kept up. I mean, even though there's been restrictions for travel, what's interesting is that you'd be amazed how many people have to travel for essential purposes. I mean, I didn't realize, but when you see the numbers coming through and the places people are going to, work-related, personal emergencies, family emergencies, the numbers are consistent. What we think will happen is that as the roadmap unfolds, which it is doing, sort of, in a positive way, people will start to travel for holiday if everything goes to plan. I mean, I think people are hedging the bets at the moment because we've got people booking in to have tests done in June, anticipating that they'll go on holiday 3 days after that. So I think people are it just goes to show you how frustrated people have been. A necessary frustration, but people are just wanting to get away and get back to life like we used to know it. So it's nice to be able to provide that for people. I think it's a bit hit and miss, right? I think where it's essential, people are doing it. We've had data that's been published nationally that show that actually people who had symptoms, I think that the figures show that, sometimes 2/3 of the population didn't really go and get a test done when they probably should have done. And that's just human nature. But, when it comes to traveling, because there are restrictions, people are getting stuff done. And with the groups that we serve in industry and, population, there's a lot of uptake for the home testing kits, the regular kind of workplace testing, twice a week, make sure everybody in your, working office environment is safe. And it's variable, but generally the uptake's been very, very good. And that just shows responsible employment. At the end of the day, that's what you want. You want people, employers, to take an interest in the health and well-being of their staff and make sure they're kept safe. And in doing so, helping the wider kind of effort around keeping the pandemic under control. So I'd say it kind of dates back to probably about November, December time, when we started to realize, I was obviously involved frontline in hospital stuff beforehand with the first wave, and then through the whole time I've been working on the NHS side. But you also see patients in an outpatient setting. So there's people who are getting sick and needing hospital beds and oxygen and all the rest of it. But there were people who had lives that needed to carry on. And it was really coming up to that second sort of spike that we had over Christmas time, or just after Christmas, when students came asking me, students I look after, young people in university and stuff who have long-term conditions like diabetes and stuff, were saying, Professor Joseph, I need to go home because I'm here studying, but actually my folks are abroad. But I can't get a test because I need a test. I can get a test where I can go down to the docs and get one of the, the NHS ones. But I need a test that's signed by a doctor so that the airline will let me on the flight so I can go home. And it was then that you realize that there was a need. There were providers around at the time, but they were exorbitant. They were charging 250, 300 quid to get one test. And so, with Dam and myself working together, we sort of set things up so that we could give it to people at a more reasonable, affordable price in real time, so that they could get in within the stipulations that the airlines give. So some airlines say you have to have it within 24 hours. Some say you have to have it within 72 hours. And we have always said that when it comes to travel, really it should only be the PCR tests, which are the most sensitive, most specific, and most accurate tests that we use. There are some airlines in some countries that allow the lateral flow test. I'm not entirely convinced that that's the right thing, but their rules are their rules, and we provide whatever is needed. But that's where it came from. I mean, there was a need. People just needed to go places, and unless somebody supported them to do it, then they were stuck. And I still remember a family that came to us. They'd actually tried to send off a postal test to travel to Australia at the time. This was just before travel was banned. And the test never came back in time, and they were about to lose all the money they'd spent on their airlines. They weren't going to see their family in Australia. And they called up in an emergency, turned up on Christmas Eve, and we were working through Christmas and New Year because there was no time for this. Turned up on Christmas Eve, did their tests at around midday, got their test results in 6 hours' time, and were on their flight and gone. It's that kind of story where we're able to help people that actually, you feel like you're doing something valuable that's giving back. And the affordability thing, we are, as far as I can tell you, is the most affordable and for people to have these tests done. So, okay, I think we are in a situation where, whilst things are moving in the right direction, we're not still 100% sure that this has gone away. I don't think it has. I don't think anyone in the scientific or medical field can say with certainty that we are completely out in the clear. The vaccine program appears to be helping, there's no doubt about that. But I keep having to remind people that the vaccines were only ever designed to try and make sure that if people did catch COVID-19, that they wouldn't get that sick that they'd end up in hospital. That was the primary goal, right? So that appears to be working because we're not seeing as many people getting sick. I know from data around the country and my own personal experience is that the numbers in hospital at the moment are very, very low. The thing that the vaccine may do, and we don't know that for sure yet, is that it could reduce transmission, but that's not a guarantee, and that there's not enough data yet to tell us that it stops it spreading, okay? So until we know that the vaccine stops it spreading, until every individual person, including kids and young people, are vaccinated with 2 shots of at least one of the vaccines, we will still have people who can potentially get sick and get sick enough to need hospitalization. So the only way that you can, with any certainty, keep those numbers under control is test, and more test. And then there's the other additional thing. I mean, I don't know if you guys heard, but today there's a double mutation new strain that has just been identified that apparently started off in India. We've got 70 odd cases in England and 4 or 5 in Scotland. And now we've got to work out if these mutated versions will keep people from getting sick with the current vaccines, or whether people who get these new mutations will get sicker and the vaccines won't be as effective. So we've got to constantly keep testing to A, figure out who's got it and keep the numbers under control. B, figure out are there new variations coming through that we've then got to address and work out are the current vaccines effective or do we need to try new vaccines? So unfortunately, the only way we're going to keep on top of all of this is test, and more test. I guess the question we've got to ask ourselves is, how do we make that part of our day-to-day life? I mean, it's all well and good kind of doing the twice a day at home where you can go and pick up, a set of test kits. You can write in, you can email in, get it off the NHS and stuff like that. It does put a lot of responsibility on the individual person to be completely upfront and wanting to do that. But we know what human nature is like, and I think there's got to be some scenarios where you might have large events, indoor, outdoor, where potentially the risk of people coming together with untested unknowns can potentially just trigger a string of infections that then spreads and spreads and spreads, and then you're back to lockdown closing. It's a situation none of us want to go back to. And I think if we really want ourselves to continue down this roadmap that continues to open and open further and not go back to another lockdown, I think I don't think there is an until, because I think the vaccine program is going to still take time. I know the vulnerable people have been done, and, but there will still be people even below the age of 40, 45 who may still get sick, and we've got to be aware of that. And I think testing is really the only way that you can keep it safe. How we're going to do that and how often we do that and the logistics is something that the government's got to dictate. But as far as Dam Health is concerned, we're trying to follow that roadmap and keeping our ears to the ground so that the moment they tell us what is the right way they think to do, because there's a lot of event stuff going on at the moment. There's a program of research around event management for coming out of lockdown to do large scale events, indoor, outdoor. Once we know what that data shows, we will then have to operationalize and be ready to provide the services that allow other events to replicate what these test events are going to do. So that's the best we can do at this stage. So, we've got big aspirations. We started off with just Fit to Fly and trying to do that, but we're now and our aspiration is, we're already national pretty much, but we want to make sure that our reach nationally is really nationally, even to the peripheries. We're up to, I think, as of yesterday, 11 clinics, and in another 2 weeks, we'll be up to 20 clinics across various cities across the country. On top of that, we're trying to support various event management companies to start doing larger events and testing on site and testing pre-events, and there'll be more announcements around those events coming through. We're also trying to make sure that not only do we look after people traveling out of England or out of the UK, but we've got obviously set up in Spain, Portugal, Czech Republic, where people coming back in can have our services too. We're also supporting with people having the test to release testing. So if you come back from a red country, or once you've had your, well, not red, but amber, when you have your day 2 and day 8 testing. So once you come back, you've got to self-isolate for 10 days, but you can shorten it by doing tests on day 2, day 5, and day 8. So we're going to support that. But we see ourselves kind of providing larger scale solutions to industry, events, nightlife, wherever there is a need. We want to be able to respond so that people can get back to doing the things they enjoy. Businesses can start to do the things that they're meant to be doing, providing services that, the general public needs. So I think, obviously we've got Liverpool, we've got Manchester, we've got 3 sites around Bradford and Leeds, we've got Birmingham, Coventry, we've got 4 sites just in central London. We've got some coming up around Kent Way, Northeast as well, we're covering now as well. And to be honest, I've kind of lost track of where we are half the time, but it is expanding. The point is, people are going to travel from different destinations within the country, different airports. And we want to be able to make sure that we have accessible sites for people to come and get tested, and then have those results in that timely manner, so that people can, spread their wings and fly when the time arrives. So the way, if we were going to do this, and again, what I have to say always is, we have aspirations of what we think is the right thing to do, but the government will obviously sign off, and we'll have to align with that. But in the perfect world, it would be pre-event testing, and the challenge, it will be about scale. So if you've got massive numbers of people, it is impossible to do PCR testing in everybody. you have the do nothing option, which is not an option. You could just say, well, let's just take a risk and we'll just go with it because the numbers are down across the country. Let's get on with it. But actually, that sits very uneasy with me, and it should do with most people. But when you have large numbers, it will probably be lateral flow, which you can get quick results. At least that gives you some weeding out and some kind of identification of mixing kind of identification. So you can say, unfortunately, you're positive. I'm sorry. Here's your refund, but we can't let you in for the event. And then you have a safer environment. If you have smaller numbers, for example, in an enclosed space like an airline, then a PCR becomes the right thing. Once you do a large event with lateral flow, then what should happen in our vision and what we use now is kind of a digital passport is what we think we'll come up with and we'll be using, which will be probably linked to an electronic ticket that the event management company and the event sponsors will have. So your ticket is linked, you turn up, you barcode scan your testing kit, and then one of our team does the swab. You run the test there, and then within 15 or 20 minutes, you've got the result, or half an hour, you've got the result of the test. You then automatically upload the result to your ticket, so it matches your ticket and your identity. You take it to the gate, and off you go. And then what that should hopefully also do is, if you start to become symptomatic, say 7-10 days later, you still have a point to recall where you are, because we report every positive as well as negative test to Public Health England now. So any test we do as Dam Health goes into a central data repository for Public Health England. And so they can link up people, whether we test them or they get an NHS test afterwards, then you can backtrack and then you can start to contact trace and keep things under wraps.
Normal in a sense.
I'd like to hope that the vaccination is the biggest thing, but I think until we know which vaccine, which combination of vaccines will cover all the variants that we keep hearing about and keep emerging, testing is the only thing that is going to keep us safe. And social distancing, that you can't put a value on that. So that's got to be our basic thing, right? It's face space, and keep your hands clean. The other big thing that people are talking about now is ventilation, because, that's the other thing that people have to think about is office spaces, I don't know. I think, you think about nightclubs and you think about going to a nightclub and your image is one of a slightly closed, very proximate environment. And we're going to have to start thinking about how we're going to start to get ventilation through, I don't know, the RAS maybe, who knows. Because if you've got testing and you can keep the rates low because you're identifying people beforehand, I suspect the roadmap will just go. I think people will just have to start making those. I think a lot of business have already adapted by getting, the sanitation measures, hand washing, making sure there's disinfectant everywhere. They have cleaning regimes. A lot of that's being done. I think it'll be a question of, finding a gradual way to try and reintroduce people to previous activities. So if you need a test, to get a test, all you do is you go online, you go onto the Dam Health website. There's an online registration page which allows you to put your details in, where you're traveling to, and basically you can pick a time slot that you need to in the venue. And at that given time, you turn up, you'll be greeted by a member of staff. They will sit you down for your time slot, you fill in some paperwork, they do your swab test, and off you go. And within the time frame that's stipulated of when you need it, usually within 6 hours or so, you will get an electronic confirmation, signed, and documentation that says that you are negative and you're off to go. If you're positive, you will get the positive and you'll get a aftercare call from one of our nurses who will talk you through what we're going to do next. We will then support you with the diagnosis, because a lot of people who come to us aren't sick because they aren't sick because you're not meant to come to us if you've got symptoms, right? If you've got symptoms, you go to an NHS testing site. We are for asymptomatic testing, so people don't know that they've got it. So, and we have had people who obviously were upset because they tested positive, they didn't think they had it, and they couldn't fly. And that's just something people have to be prepared for. But we do make sure that we give them a supportive call, we direct them to NHS 111, or if they develop symptoms, we tell them what they need to do, and we let Public Health England know so that we can triangulate. But essentially, online booking, turn up, have your swab, go home, and wait for an electronic confirmation.
That's the first time anybody's mentioned the RAS in one of these videos.
I know.
Well, if you're thinking about the most dingy, closed-off place that you can think of,
that underground.
the underground,
Yeah.
the Blue Angel Bar. I've spent a few nights there.
If you enjoyed that video, then please subscribe to our YouTube channel on the link below and be among the first to get to listen to all the latest interviews through the Downtown Den.